Мене звуть Наталія Dvinskykh.
We start. I am Nataliia Dvinskykh. I'm expert for monitoring and evaluation AFEW-Ukraine. I am Bondar Tetyana. I'm the director of Ukrainian Institute of Social Research, named after Alexander Yeremenko. And today we present preliminary result of the survey covering certain aspects of health of minors who are imprisoned in Ukraine. That was done in the framework of implementing the project of bridging the gaps and the support of the Ministry of Foreign Affairs of Netherlands. The design of the research was developed and the team was trained with the support of the Dutch experts, Gerda van Koft and Marieke van Genabek, and the support of the Department of the Ministry of Justice of Ukraine. We are also very grateful to our great research team and to the staff and administration of the penitentiary institutions, pre-detention facilities, and those teenagers who participated in the research. I will tell you a couple of words about the methodology of this survey, how we did it, when, and who our target audience were. The key target audience, those were imprisoned boys and girls aged from 14 to 18 in penitentiary institutions. And the second target group, that was the specialists who work or who provide assistance for minor inmates, and these are also educators and medical staff who work in those institutions. So we covered 142 persons who were covered with the survey. Actually, we focused on those institutions where there were at least 5 minor inmates, and then we covered them all with the survey with those subjects who met the survey criteria. This is those who were in the age group of 14 to 18, who provided the informed consent, who were not hospitalized, who understood Ukrainian or Russian so that they could independently read questions and provide answers. And of course, for the participants, we ensured all the ethical preconditions for the survey. This is voluntary participation, informed consent. So the survey, only those participated in the survey who provided the informed consent. And if they could and wished, they could sign the form, informed consent form, or they could provide orally agree to that, and the interviewer made a mark on that. The toolkit was approved by the Commission for Professional Ethics of the Association of Sociologists in Ukraine. And of course, we had some limitations in the study. In this survey, nothing new. This is about the lockdown. So we had to revise the method a little bit because initially we planned that the questionnaires will be filled in independently at the presence of the interviewer. But actually that had to happen on Skype because it was not possible to travel because the field phase was held under the strict lockdown or adaptive quarantine, so the institutions' facilities were inaccessible, but we are grateful to the penitentiary service because it was possible to organize that in the online mode, and that made it possible for us to provide you with some data. We used several tools. One of them, it was strengths and difficulties that cover psychological problems of the minors. This is a quick scanner that makes it possible to think about what to do next in order to address further needs of the minor if they need any medical intervention or not. That is easy to fill in the template, and it can be used both for minors and for specialists. So the minors filled in this instrument about themselves, while the specialists, the experts fill in the questionnaire to cover the minor. So we have 142 questionnaires filled in by the specialists as well. You will see how it impacted the results. It's interesting to see the different versions as presented by the minors and as presented by the staff. The content of the strengths and difficulties as DQ questionnaire is this. It consists of 25 items that cover 5 scales: emotional problems, conduct and disorders, hyperactivity, deficit of attention, problems with peers, and pro-social behavior. For pro-social behavior, it will include the following aspects. I try to be kind to others. I'm attentive to their feelings. I usually share food and my personal belongings with others. I try to support those who are sad or unhealthy. And then the respondents say if it is fully about them, partially about them, or not about them at all. When we analyze that, we attribute the score, partial about me 1 or 0 if not, it is not about me, etc. Let me also add them that the survey was limited by 6 months. I mean, all the questions that the respondent had to address, that was done in view of understanding that that was supposed to cover the period of 6 months. Very often you see it on the screen. We reminded them about that because sometimes the minor said that it happened a year ago or 1.5 years ago, but we took them back to that 6 months period. So when we count the score, we had the categories of normal, high risk, and very high risk. And of course, high risk, it requires more attention. This is screening. This is not about deep analysis of a problem. So this is like a scanner that detects crisis situations or maybe some problems that need to be checked with the expert and with deeper questioning or with clinical observation. The next instrument that we used, this is MACI-2, Massachusetts form for youth screening form or instrument. This is another screening instrument developed for juvenile justice. It is intended for young people aged from 12 to 17. There are 52 questions and you answer yes or not. Now, pros and cons of this instrument, screening instrument. Actually, screening instrument do not make it possible to set clinical diagnosis. It is used for those teenagers who are in crisis or who need further expert evaluation. Sometimes screenings provide some additional information because they depend on the perception and feelings. Many hide their feelings and then many exaggerate. The scales cover use of alcohol and drugs, anger, resentment, depression, anxiety, somatic complaints, thoughts about suicide, traumatic case situations. And then again, we attribute the score. And so again, we have the categories of normal or note or take note. It means that you need further consultations or with the specialists, and then something that requires further consultations, advice of the specialist, and what requires further attention. So now we will share certain results, and you see that here the data that cover minors. This is the instrument of strengths and difficulties and the experts. So for behavior, for conduct disorders, most minors believe that they are okay, 63%. They say that they have no problems about that. while among the experts, it is a little bit more than 1/3 of respondents believe they have that. And also what's interesting it is that there is quite a high difference in scoring regarding fluctuations or diversions from the norm. This is something that requires more attention. So there is a significant percentage of the experts there, and among minors, the percentage is 3 or 4 times higher. Same problems with peers. About 17% believe that they do exist, while for experts, they believe that 37% have that. So this is the analysis, the screening that is required in order to see what happens next. So this is the scanner of the atmosphere, what we have there, what minors think about, what attention needs to be attracted to. So if we compare answers of minors and experts, what troubles the minors most, these are problems with the peers. This is medium and high risk. If we combine them, for experts, this is conduct disorders. And also we see that there are problems if we consider social aspects, and problems, minors also mention emotional problems. So interesting are results on the social scale. 80% of minors believe that they have good intentions, they express them, and they understand what the society expects from them, while the experts are not so optimistic. But this distribution of answers, I believe, of responses, makes it possible for us to believe that changes are possible. And when using the programs that rely on the strengths of minors, we will be able to see positive results. The next result of the instrument, this is Macy 2 instrument, and here we see that most of our respondents believe that they are in the normal scale regarding use of alcohol, anger, resentment, that they have had that during 6 months prior to the survey. 44% were depressed and had anxiety episodes. Based on what they mentioned, they were very anxious about the strict lockdown conditions. They were concerned about their families. They were concerned about that they could not talk to their families, that the families could not travel to see them. They could only talk to them on the phone. So this is something that we could also mention about the quarantine, but for somatic complaints, there you can see that more than half, well, this is not their estimate, this is our estimate, but we believe that more than half of them require some attention, some support by the specialists. We also see that 21%, there is 21% of those who require certain assistance because of suicidal ideation, and some also have the reasoning disorders. So this is about seeing what doesn't exist or hearing voices, etc. So there is something that needs further exploration, further work. We just recently completed the field stage, but there is a lot of work for those specialists who work with young people who are in penitentiary institutions. We see that we see that suicidal ideation, it has the least score, but we should not ignore that, because every case like that requires further attention and support by the experts. Then we see alcohol and drugs, anger and resentment, depression, anxiety, somatic complaints. This is what we see there too. Quite often, adolescents hide anxiety behind their anger or resentment. In many cultures, depression and anxiety are expressed by somatic complaints, so that also requires further investigation. Here we have rather unexpected results. This is about reasoning disorders. You see 36% high, 26% high risk, 38 moderate risk. Well, we believe this is because that was an online survey and maybe children had problems reading the questions. Probably some of them didn't understand them properly, because when we tested the questions, these questions were not that clear. However, again, that requires further investigation. So far, this is not that clear. Interesting results. This is traumatic experience. 89% say that they have had some traumatic experience. We cannot now say what the impact of that was, but that is also something that requires further research. 54 people mentioned that they think a lot or they have dreams about some terrible events that had happened to them. So that is a trauma that had some effect on them, but we don't know when it happened, whether in childhood or now, how it was compensated. 96 people out of 142 have seen some who were seriously wounded or were killed, not on TV, but in real life. That's high. Also, we asked a question about experience of using alcohol and drugs. And while the experience of using alcohol, that's 90%, and all in all, we know that adolescents who are not in penitentiary institutions also have extensive experience using alcohol. But here we also asked questions about problems related to use of alcohol, whether anything bad happened to you when you were under the influence of alcohol or drugs, and if you did under that influence when high, something that you would complain about or you would regret about. So you see that for alcohol-related problems, more than half of them know that they have those problems. Then 40% said that they have had the experience of using any drugs. 40% did not use drugs. 60% did use drugs, sorry, that is vice versa. And 37% said that they understand that they had problems related to drugs. So these are preliminary conclusions. We focus on the following problematic areas. This is communication with peers and conduct problems or disorders. This was quite high based on both questionnaires filled in by adolescents and by specialists. So the behavioral problems, it is not like interfering with the teacher during classes. These are serious conduct disorders or conduct problems. And this is quite a serious, aggressive behavior violating rules and social norms. Based on the adolescents' questionnaires, they say that they also have emotional problems, which can be disguised as conduct behavior, conduct disorders, anger, resentment, somatic complaints. Experts believe that it is important to influence to transform pro-criminal reasoning and pro-social behavior. It's also important to focus on traumatic experience and the experience of problematic use of alcohol and drugs. For reasoning disorders, here this requires further surveys, and we will see whether we confirm that. So we will finalize now, and we see someone who wants to ask a question. So You can write in the Zoom chat window. So if there is someone who would like to ask a question, there were two hands raised. While we are waiting. So obviously that's not possible now. So, but in the future, we will continue these surveys, and on our website, you will see the final findings of the survey. And thank you for your attention.